In this video, I'll talk about how to establish boundaries when it comes to working and interacting with children on the spectrum. But first, let's start by understanding the concept of boundaries. Boundaries refers to the limits or guidelines that individuals establish to define and protect their personal, emotional, and physical space. These boundaries help maintain a sense of self, establish healthy relationships, and manage interaction with others. Boundaries can exist in various aspects of life, including personal relationships, professional settings, and social interactions. There are different types of boundaries, such as physical, that includes personal space, emotional boundaries, that include acknowledging personal and other people's emotions, mental boundaries, that include respecting the thoughts and beliefs of others and allowing yourself to think independently, time boundaries, that include how much time you spend on various activities, commitments, and relationships. And last, material boundaries that include respecting each other's property and possessions. When interacting with children with autism, it is essential to establish clear boundaries to ensure their safety, well-being, and development. Boundaries provide structure and consistency, which can help the child understand expectation and reduce anxiety. So, how do we establish boundaries? Here are some general guidelines that may help you with this task. First, be consistent. Children with autism often thrive in predictable environments. Establish consistent rules and routines, as well as consequence for breaking rules. Consistency helps the child understand what is expected of them in their situations. For example, every time the child is done playing with toys, you will ask the child to clean up and make this task a part of the child's routine. Second, use visual supports. Many children with autism benefit from visual supports like schedules, charts, or pictures to help them understand and remember rules and expectations. This visual can serve as reminders and make boundaries more concrete. For example, you can use visual cues such as stop on the door to remind the child that they can't leave the house without an adult. Third, be clear and concise in communication. Use simple, direct language when communicating rules and expectations. Avoid ambiguity and be specific about what behaviors are acceptable and unacceptable. For example, if the child tries to elope in a store during the walk in the mall, you will run together with the child, guide the child by the shoulders in the opposite direction by communicating clear and concise. It's not available. Fourth, positive reinforcement. Reinforce positive behavior with praise or rewards. Positive reinforcement can be a powerful tool to motivate a child with autism to follow the boundaries and rules. For example, if the child looks at the stove and says, "No touching," you'll immediately acknowledge the child's behavior and provide verbal praise. Fifth, understand individual triggers. Each child with autism is unique, so understanding their specific triggers and stressors is crucial. Try to minimize or avoid situations that may lead to meltdowns or challenging behaviors. For example, if you know sound or light are triggers for your child, to invade someone's personal space by grabbing or pulling, you will provide the child with headphones or glasses, or teach the child to functionally communicate by requesting a break or telling you all done. Immediately after the child functionally communicates, you will allow the child to retreat into a calming environment. 6. Safety first. Prioritize safety above all else. Ensure that the child is safe in their environment and establish clear guidelines to prevent dangerous situations. For example, you'll use safety locks on the door, safety locks on the kitchen drawers, and cleaning supplies, fence, backyard, food tracker, or cameras, and so on. 7. Allow for some flexibility. While consistency is important, it's also essential to allow for some flexibility in certain situations. Rigidity in rules may cause unnecessary stress for the child. For example, if the child has a certain routine of sleep and eat, and one day the family had an event that delayed the child's bedtime, then we want to reinforce those life changes and teach the child flexibility. 8. Involve the child in rule setting. When appropriate, involve the child in discussions about rules and boundaries. This can help them feel more ownership and understanding of their expectations. For example, you can teach the child that inside we are using a quiet voice, and when outside at a park or playground, we can use a loud voice. Offer different environments and prompt the child to tell you what rule is appropriate for each environment. 9. Social skills training. Teaching social skills explicitly helps the child understand appropriate behavior in different social situations. Role playing and modeling can be useful techniques. For example, you can teach a child to read body language by identifying people's emotion. Here, you can offer pictures and videos with different emotions and ask the child to identify them. 10. And last, set realistic expectations. Recognize the child's individual strengths and challenges and set appropriate, achievable expectations. Adjust boundaries based on the child's ability and developmental level. For example, you will not ask a 2-year-old child to sit at the table for 15, 20, or 30 minutes and do work. This is an unrealistic and an inappropriate expectation for the child. The approach to setting boundaries may need to be tailored to the child's individual needs and abilities. Patience, understanding, and empathy are essential when interacting with children with autism. I hope this video helped you learn how to establish clear boundaries with a child on the spectrum. If you have any questions, make sure you type them in the comments below, and I'll do my best to get back to you. Thank you for watching. I'll see you in the next video.